Ever rushed to the bathroom, barely making it in time? Or maybe you've had a surprise leak during a good laugh, a big sneeze, or even a workout. If so, you're definitely not alone. Millions of people deal with bladder problems every single day. But here's a crucial fact. Overactive bladder and urinary incontinence are not the same thing. In this video, we're going to break down their key differences and explain how understanding them can help you get back to feeling comfortable and in control. So let's start with the basics. Overactive bladder, often called OAB, is what's known as a syndrome. That means it's a group of symptoms that together define the condition. These symptoms include a sudden, intense, and uncontrollable urge to urinate, needing to go to the bathroom frequently, talking more than 8 times a day, and even waking up at night to pee. While OAB can sometimes involve urine leakage, it doesn't always. On the other hand, urinary incontinence, or UI, is different. It's actually a symptom, the involuntary leakage of urine itself. There are a few different types. Stress incontinence is when you leak a little when you cough, sneeze, or lift something heavy. Urge incontinence is when you have a sudden, strong urge to go and leakage happens right after. Then there's mixed incontinence, which is a combination of both. So the main distinction is this. OAB is all about the urgency and frequency of needing to go, while UI is specifically about the leakage. Here's how you might notice the difference in your daily life. If you have overactive bladder, you might find yourself constantly mapping out the nearest restrooms and rushing to the bathroom often, even when you know your bladder isn't full, but you don't actually leak. With pure incontinence, you might experience leaks during physical activities without feeling that sudden, urgent need to go. Of course, some people experience both conditions at the same time, where a sudden, powerful urge is immediately followed by leakage. Recognizing which of these scenarios sounds more like you is the first step toward getting the right help. So what causes these conditions? Well, overactive bladder often comes down to involuntary bladder muscle contractions or issues with the nerves that control the bladder. Certain health conditions like diabetes can also contribute. Urinary incontinence, however, is typically linked to weakened pelvic floor muscles. This can happen for various reasons, like after childbirth for women or prostate surgery for men. Both conditions do share some common risk factors, including aging, obesity, and even your genetics. Getting a proper diagnosis is absolutely essential for finding an effective treatment. Your doctor might ask you to keep a bladder diary to track when you go, how much, and if any leakage occurs. They might also perform a pelvic exam or run more specialized tests. For OAB, a test called urodynamics can measure bladder function, while for incontinence, a simple pad test can quantify leakage. These evaluations help pinpoint the exact cause of your symptoms and create the best treatment plan for you. And here's the great news. Both OAB and UI are highly treatable. The first line of defense often involves simple lifestyle changes. This includes bladder retraining, where you gradually increase the time between bathroom trips and doing casual exercises to strengthen those important pelvic floor muscles. Managing your fluid intake strategically can also make a big difference. If these initial steps aren't enough, there are more advanced therapies available. Medications like anticholinergics can help calm the bladder and reduce urgency. And for more severe OAB, Botox injections can be an option. For stress incontinence, a procedure called sling surgery can offer a long-term solution. With the right approach, most people see a significant improvement. Finally, let's bust a few common myths. Many people think OAB and UI are the same thing, but as we've learned, they're not. OAB is a syndrome of urgency and frequency, while UI is the symptom of leakage. Another myth is that coffee is the root cause. The truth is, caffeine can irritate the bladder and make symptoms worse, but it doesn't actually cause these conditions. And maybe the most harmful belief is that bladder problems are just a normal part of getting older. They are not normal, and they can be treated at any age. Remember, bladder issues are common, but they shouldn't be accepted as a normal part of life. Over 80% of cases can be significantly improved with the right care. So please don't let embarrassment stop you from seeking help. Talk to your doctor, explore your treatment options, and take that first step toward reclaiming your freedom and confidence. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips. We'll see you in the next one.